The first thing that we look at when we talk to a company is what problem are you trying to solve?
Sure.
And oftentimes they cannot articulate
Mhm.
that. They have fallen in love with their
Oh,
solution
definitely. Or their
and
technology.
yes, or their technology, and they can't articulate why I should also love that technology.
We're here today with Lisa Prasad. Lisa is the Vice President and Chief Innovation Officer at Henry Ford Health in Detroit, which is one of the largest. Is it the largest or one of the
One
largest
of the largest, I
health
believe we're
systems?
second right now in the state.
Okay, so U of M, and then there's
No, Corwell.
oh wow,
Yeah.
wow, okay.
Yeah.
So one of the largest healthcare
Yeah.
systems in Michigan, and so in her role, Lisa is responsible for driving innovation strategy and technology development and product commercialization
Yes.
and industry collaboration. So, Lisa, you had a fascinating career, and looking at it from my vantage point, the career spans management consulting and community and economic development, startup entrepreneurship, hospital system management, and entrepreneurship support and facilitation now here in the wonderful Innovation Institute at Henry Ford. So I want to explore all of that with
Okay.
you, and appreciate you having us. Thank you
Thank you
for.
so much. And when you put it like that, it really sounds like I've had a very fractured career, doesn't it?
This sounds varied, and it sounds interesting to me.
That
Uh,
has been.
so really interesting. This is a urban entrepreneurship initiative is about identifying entrepreneurs who are doing kind of groundbreaking things, and you've certainly done that. And so, the journey that you've been on, I think, will be interesting to a lot of people. So, I want to start with your origin story. I'd like you to tell me about your upbringing. I understand you're from right here in Michigan.
I am. I am from right here in Michigan, but actually, I was born in India and I moved to the US when I was 10 years old.
Hmm.
Um, I did not speak English when I came here, so I like to tell the story that I learned how to speak English by watching Gilligan's Island on television. And while one, that's funny, what really is relevant to this conversation is that at a very early age, I was thrown into the unknown.
Hmm.
So coming to a place where you don't know the language, you don't have any friends, you don't know what the surroundings are like. I think that has really helped to shape uh, how much I appreciate and do well in uncertainty,
Hmm.
which I'm sure we'll get into later on when we talk about entrepreneurship. But yes, so I moved to Michigan when I was 10, eventually learned to speak English, uh, went to the University of Michigan for my undergrad, and I went to the University of Pennsylvania for grad school. I moved to Philadelphia, lived there for a decade, and uh, I guess if we really focus on my upbringing, the one thing that I'm constantly reminded by my parents is that I was always a very curious child.
Hmm.
And that curiosity has probably driven my career in all of those different directions that we just talked
Hmm.
about. And that served me well, but it's kept me from having a straight line career path.
Hmm. So your undergrad education was at Michigan, and that was in what?
English and political science.
Okay, and then your grad school at UPenn.
I have a master's in government administration, which was basically the public policy degree in that time, and I have a master's degree also in international relations.
Okay, and so then after college, after your master's degree, what then?
After that, so I went to grad school thinking that I would come out and I would have a job that saved the world. So I was looking for a job with the World Bank or the United Nations or the World Health Organization, something like that. Uh, but when I graduated, the economy was kind of on a downturn, so it was a little bit difficult. But I landed at Cooperson Library Consulting, which is, of course, now PricewaterhouseCoopers, but back in the day, it was Cooperson Library. And I got a job in their higher education consulting practice, which was okay for me because it's still all the clients were higher education institutions and academic medical centers. So it still appealed to my sense of wanting to do good in the world,
Yeah.
even though it was in the private sector. But
Yeah.
it was a good start.
I was just with a group of students last night on campus at Michigan, and I think two things are still true. I don't know if they'll always be true, but the students there want to change the world,
Yeah.
and they're very interested in consulting. So I think that, and that latter thing, the consulting thing, seems to be even more intense now than it was, back when I was a student. When I was a student, everybody wanted to change the world, right? But the consulting thing is a new thing. A lot of interest in that.
Consulting is very interesting because it throws you into so many different situations. You have different clients, you have different projects, you have different places that you travel to.
Yeah.
So I think it's a great training ground for young minds. The problem, of course, is that you solve a problem and you go away. So even though you learn about a complex organization, you never really learn how to do things in a complex organization. So for that, you have to actually work in one of these
Yeah.
organizations.
And when you do that kind of consulting, are you actually solving a problem, or are you presenting a solution that you think would work to them and kind of leaving it to them to implement?
Well, good point. It's mostly the latter.
Mm.
Yeah.
Yeah. So what kinds of things, just briefly, give me an example of a higher education project you worked on in your consulting practice?
Back in, I keep saying this as if it was 100 years ago, but it wasn't really 100 years ago. But we used to do a lot in process reengineering. So how do you take your procurement process, for example, and reduce work steps so that it becomes smoother? How do you take your facilities management practices so that you can respond more quickly to the needs of the buildings on campus?
Yeah.
There were business problems just applied to a campus instead of a high-rise AUKUS building. Uh, we did do some on the academic side as well. So, for example, if a university was bringing up a new financial system, how do you define the functional requirements of that financial system? So, projects like that.
So how did you like consulting?
Loved it.
Yeah.
Loved it. Loved consulting, but got tired of the travel pretty quickly. And also, I did begin to feel like exactly to your point, I was providing the recommendation and then leaving and moving on to the next project, never really knowing if those recommendations were implemented or if they were implemented well. Did it work?
Yeah.
So, yeah.
Yeah. So what was next? What was after?
So then I went to work for one of these complex organizations. I went back to Penn and I became the chief of staff for the executive vice president of the University of Pennsylvania. So the executive vice president had all of the administrative functions reporting up through him, finance and business services, anything that had to do with anything that didn't have to do with the academic side.
Okay.
So it was a fascinating time to be at a university like Penn because they were really thinking about how to do community development in a more integrated way. And that became one of my passions when I was at Penn.
Yeah, I think most people, or a lot of people, don't know where UPenn was situated or what the situation was. Can you kind of describe that?
Yes, at the time, Philadelphia was not a very desirous place to live. And Penn was situated in West Philadelphia, which was also not a big recruiting tool, let's say. There was a year where a couple of graduate students were actually murdered very close to campus. And that caused a outcry, as it should have. And a new president who came in, Dr. Judith Rodin, she made a statement that we are of this community and we're going to invest in the community, and thus began the West Philadelphia initiatives that University of Pennsylvania launched. And that really became the first time where a university embraced the urban community that surrounded it and decided that it would work in partnership with them to create a better campus, a better community, a better city around themselves.
Yeah. Well, hearing about that kind of thing certainly resonated with me because that's what we're about. That's what we've been about here in Detroit and my hometown of Flint. We would love to have an impact on uh, improving the quality of life, and improving the community vitality in these cities. And to know that a university was taking that kind of thing on, they have an interest for themselves in doing that, but sounds like there was a lot of community interest in that. So how did that go? Tell me about how that project worked.
Amazingly well. It was a decade, 2 decade long commitment. It was not a single project where we're going to do X and be done with it. It was a commitment in creating more real estate development activity, in creating more amenities for both students and people who lived in the community, better housing stock, better education options for people who lived in West Philadelphia. It was a multi-pronged project, and over the years, it really has become a model for how a university can really open themselves up and take the economic vibrancy that lives within them and leverage it for betterment of the community that surrounds them.
Yeah.
Now, if you go to West Philadelphia, you won't believe what a vibrant place it is. I was actually recently in Philadelphia, and even I'm blown away at how far this campus has come in 25, 30 years.
Yeah.
And back to the self-interest of the university, back in the day, people did not realize that the University of Pennsylvania was an Ivy League university. But now it's one of the highest ranked universities in the world, always in the top 5.
Yeah.
So it had, I think the initiative and this program was very impactful.
Yeah. Well, I'm certainly interested in how a university can have that kind of impact on a community. And here in Detroit now, we've got the U of M Detroit Center that is being built, and we've got Wayne State just up the street that's been here, forever. Uh, I'm curious about, when you talk about creating new housing, facilitating more businesses in the area. How does that work for a university? I mean, it takes money to create, their housing, and it takes some savvy about entrepreneurship and business to create. That's not normally the kind of stuff you associate with a university. So I'm wondering how they were able to pull that off.
Yeah, which is why it really made it unique. How did they pull it off? They pulled it off by understanding and appreciating that they needed to incubate the market. And if they incubated the market, whether it's for housing or retail or whatever else, then private capital would follow. So that's what they did. The first couple of projects, they ended up having to subsidize. But then once they proved that the market was there, the private sector stepped in. So they went from the university having to fund its own projects to then doing joint venture, then just doing land lease agreements where others would bring in the capital to actually build the real estate. So it was a continuum, but it really all did begin with the university saying, okay, we understand that we need to do the incubation, and then the market will come. And it did.
Where did the money come from for the university's investment in all of these efforts?
That I can't say, but it's a large university when you have a $5 billion, which it must have been back then, $5 billion institution. Somebody somewhere, if this is a priority of the trustees and the president, somebody somewhere can find a couple $1 million.
Okay.
And I don't mean that to be trite. I know that that's a lot of money.
Yeah.
But again, it's about priorities, and all institutions have to find money to invest in their priorities.
Yeah.
And if this is a priority, this is where you invest.
Mm. So monies, for example, from their endowment fund, they might use to invest in some of these kinds of
Yeah, sure. Then
projects.
I don't know if it came from the endowment or
Yeah.
operations. That wasn't part of my
Yeah.
my role. But they did.
So you were involved in crafting these strategies.
Yes. Yes.
And
Crafting these strategies and implementing the
yeah,
strategies.
yeah. So how long did you do that?
I was at Penn for I could be off by a few months, but I was there for about a decade.
Mm.
Yeah.
Wow. Okay.
Yeah, long time. Long enough to see the benefit of the work that we were doing.
Yeah.
Good.
So now that brings us to your foray into entrepreneurship, right?
Yes.
So tell me about that.
Yeah.
So you were at Penn, you were doing this community development, uh, university centered community development,
Mm-hmm.
and then you did what?
So I left the university, and with a partner, we launched U3 Ventures, which was our company. So what I would tell you is that, there's a saying that some people are born leaders and others have leadership thrust upon them. So I like to say that about entrepreneurship. Some people are born entrepreneurs and some have entrepreneurship thrust upon them.
Yeah.
And I was the latter.
Mm.
So I don't know that I envisioned myself as an entrepreneur before I actually did it.
Mm.
This was an opportunity that presented itself to really take what we had learned and create a business and around our learnings, and then use that to impact other institutions. So I could have stayed in one place and done more and more,
Mm.
but I wanted to do this at other places too.
Mm.
And so we created a company. It was a stressful time because it's hard to leave.
Yeah.
It's hard to leave a solid
Yeah.
job
Yeah.
and say, okay, well, I'm going to do this for myself
Yeah.
now. And
Probably well paying.
yes, it wasn't bad. And to say, well, I'm going to do this, and I will hope that clients come.
Mhm. So I mean, what motivated this?
What motivated this was two things. One, I had a partner who really felt strongly that we could do this.
Was this one of your colleagues?
Yes, one of my colleagues at UPenn,
Yeah.
who really felt strongly that we could do this. So this was part of the thrusting upon me,
Yeah,
right?
yeah.
So, and I began to drink the Kool-Aid, and I kind of said, okay, if I don't do something like this now while I'm relatively young, when will I do it?
Yeah.
And so we took the jump.
Mhm.
It was.
So the
I don't know what to answer your question. I have no idea. I just did it.
So I mean, and this is one of the things that I get asked about all the time from students, and this is why I kind of drill down on this area, because you're in a secure job, you're doing well, you have recognition and security and whatnot. How does it work? I know how it worked for me, but how did it work that you left? All of a sudden, you don't have the nights off. You got to find an office. You got to
Well,
pay yourself. You got, how did it work?
it worked well until it didn't. You learn a lot about yourself. So, starting from the day where you look yourself in the mirror and say, okay, I'm going to do this. This is going to be okay. I'm going to try it. And what's the worst that can happen? If I fail, I find another job.
Mhm.
And you just have to believe that you could find another job with
Yeah.
a backup. So that's where I was. And then I don't know what we did next. We really set out trying to find some clients.
Yeah.
And trying to raise a fund so that we could invest in real estate.
Yeah.
Trying to define our marketing strategy, our branding, everything that one has to do when you start a new company.
Did you have this client, an idea of this first client when you started the company?
We did. We had ideas, but we didn't have any solid contracts.
Mm. Okay. So So I'm assuming you got some, though. You signed up
We
some
got
clients.
we got so
So,
we got some solid contracts. We got some consulting contracts. We were well known in Philadelphia because we had done all this work at Kent. So a lot of our contracts came from other local universities that we started looking at. Uh, we also were fortunate in that we were able to raise a fund as a small fund, but we did become general partners in a fund from that was largely from high net worth individuals, and we were able to invest in properties around Philadelphia, around other universities in Philadelphia. So that kept us going for a while too.
Mhm. So give me an idea of the business model of how this worked. You were uh, a consultant for uh, XYZ University, and you would develop a strategy, a community development strategy for them.
Yeah, so the goal when I left the University of Pennsylvania was never to go back to consulting.
Mm,
Our goal was to actually do the development,
okay.
invest in the properties, and help the university put in place programs that can then leverage the value of the property. So that was sort of the business model. Um, but we needed something to kind of get us from day one to year three, when the properties can begin to generate revenue. So consulting was supposed to be a very short term,
Okay.
and uh, and we did do consulting projects where we didn't invest because we were just trying to get to the time where our investments would then be generating revenue. But then in the midst of all of that, the economy fell and capital markets dried up. And this is what entrepreneurs do. Then we had to completely pivot.
Yeah.
So we had this fund, we had the investments, uh, and then
So this was the 2008, 2009 situation. Okay. So the investment dried up at that point.
the capital markets dried up, and you don't do real estate development without debt. So the debt just went away. We still had the equity. We were still holding the equity,
But you couldn't leverage that.
but we couldn't leverage it.
Yeah.
And then we had to pivot back into consulting because that was a cash generating thing that could give you a paycheck.
Yeah.
Very difficult times, and I will tell you that during those times I really questioned the horrible decision I have made.
Right. Well, I'm curious, so I'm from Flint, and in Flint, you know the story of Flint, how it's fallen on hard times from at one point being having the second highest per capita income in the United States back in the 60s. And there's a university in Flint, and there's a community college, and so I'm curious if an entrepreneur wanted to be Lisa Prasad, and they say, okay, we're going to take this strategy and we're going to reinvigorate Flint using the same kinds of what kinds of things would they do, just in general?
So I'll give you a real live example. Okay, it was in Cranes a couple days ago. Henry Ford is building this new hospital, right?
Yeah.
So they're investing $3 billion on this campus around here.
Yeah.
And this entrepreneur has come in and bought several buildings in this neighborhood, and they're now investing in bringing those up and turning them into housing.
Because they
That
know what's
is
coming.
because they know what's coming. That is the perfect example of how this anchor-based strategy works. The anchor has incubated the market. They had showed the market, look, we are putting $3 billion here. We are committed. We're not going anywhere. We're hiring people for our facility.
Yeah.
There is going to be activity here. And then others are coming in and saying, okay, there's going to be activity here. How can I take advantage of that? Well, I can buy this building and I can refinish it and I can lease it out. I can put a store here. A number of different things can be done. But that's exactly
Yeah.
This is exactly the anchor strategy at work here in Detroit, right around my campus.
So that's an example of real estate development as a tool for economic development. But I would imagine there are other avenues too that one could participate in. What other kinds of things might an investor do besides real estate development to take advantage of that anchor situation?
The other one is what I do now on a day-to-day basis is really leverage the intellectual property that gets created within the institution. So within a Henry Ford or within a U of M Flint, within U of M
Yeah.
Arbor, there are lots of researchers who are creating inventions. There are people who are coming up with new ideas. There are students who are very clever. All of that intellectual property is there.
Mhm.
And if someone was motivated, they can be working with the university to commercialize some of
Mhm.
those things in
Mhm.
partnership with the university.
Mhm.
So we do that all the time here at Henry Ford. We have researchers who are coming up with new inventions. We're the
Yeah.
team that protects that, patents it, and then we try to identify ways to partner with other companies
Yeah.
to push that into the market.
Yeah.
We have created probably a dozen spin-off companies, and most of those companies have been in partnership with a entrepreneur
Okay.
who has licensed that technology from us
Yeah.
and then said, okay, I am building a company
Yeah.
around this technology.
Okay.
And they will, if it's successful,
Yeah.
that will be a success for them
Yeah.
personally as well.
So I want to come back to that in a few minutes. Certainly, that seems like a more complex and longer term thing than the real estate development.
More complex for sure. I don't know about longer term.
Well, yeah, I
Yeah,
guess real estate
yeah.
uh,
The real estate takes the
return can
longest
take a while
time.
too. But going back to the company was called that you had founded coming out of.
U3 Ventures.
Okay. And so you started out trying to do this development yourself with a little bit of consulting to
Mm,
kind of pay the bills, keep the
yeah,
lights on. And then you had the financial crisis, so you had to focus more on
on consulting.
consulting. And then how long did that go? How long did you stay with the U3 Ventures and what happened with that?
I stayed with U3 probably 8 years, I
Mm,
would say. And what happened is that I rediscovered Detroit.
mm,
One of our consulting clients ended up being in Detroit. We were
mm,
hired by the New Economy Initiative, which
mm,
was really at the time, I think it still is, a conglomeration of the Kresge Foundation and Hudson Weber and other
mm.
foundations who have created
Community
this
Foundation of
community.
South.
Yeah,
Yeah.
yeah. So we were hired by the New Economy Initiative as consultants, and basically what they said is, as we have this financial crisis going on, businesses are leaving Detroit. What is staying is Henry Ford Health, Wayne State University, and Detroit Medical Center. They are anchor institutions.
Yeah.
So, how can we create programs like you guys did at Penn for these anchor institutions to increase their economic impact on the city?
Mm,
So we started working with NEI and others within this ecosystem of Detroit to help create those programs. We did that for, gosh, we were here for 2, 3 years doing that work. And during that time, I met the CEO of Henry Ford Health,
mm,
and she was envisioning this Innovation Institute.
mm.
So I got to learn about what they wanted to do here, and I met the team here. And I've always been looking forward to coming back to Michigan
Yeah.
because this is home.
Yeah.
So I decided to leave U3
Mm.
and come back and
So you did that
basically work here.
as a consultant?
I did. I did
Yeah.
that as a consultant, just because it was the easiest. Sometimes you have to take the easiest path forward,
Mhm.
even if it's not the one that's maybe the best at the time,
Mhm.
and just hope that it works out. And it did.
Yeah.
So I became a consultant at Henry Ford, and I was for 3, 4 years.
Mm.
And I helped them build the program that has now become the Innovation Institute.
Mm. And so what's the function of the Innovation Institute?
The Innovation Institute is our So, the mission of the Innovation Institute is the following: it's to improve patient care and outcomes, it's to help Henry Ford recruit and retain the higher caliber of clinicians and staff,
Mm,
and it's to provide economic impact both internally and externally.
mm,
So we come at this from a very mission based perspective. We commercialize technologies that get developed in house. So
mm.
I already talked a little bit about the inventions. We
Yeah,
push those out, we create the spin offs.
yeah.
We work with industry collaborators, both large and small. We'll work with think Premier Applied Sciences, think Roche, if they have innovation projects and they need real world evidence, real world data,
Mm,
clinical input, we work with them on that.
mm,
But largely, we work with early stage technology companies. We have found that there are a lot of great technologies that are being created, but these technologies have no way of entering
mm,
the healthcare market because they may not know the regulations, they may not have clinical validation, they may not know how to navigate the procurement cycle. They don't know how budgets work inside a health system.
mm,
So we become the team that works with those early stage technologies to help them make their company viable.
mm. So you've got uh, developments or innovations that occur within the hospital that uh, need to be commercialized or you might want to commercialize.
Mhm.
You've got uh, entities outside of the hospital, inventors or companies that come up with something that they they might be candidates for having their thing adopted by the system and commercialized. And then you've got maybe larger companies that you partner with that they may have something they're developing that they want to see how it works in a clinical setting.
Right.
Those are the three main cases.
Yes, and then we do a number of other things, like we do 3D print for surgical planning,
Mm,
and we help our inventors build prototypes to see if their idea can
mm,
actually be adapted into real world use.
mhm,
We run fellowship programs. We work very closely with Michigan State University on a number of programs.
mm,
So it's all of that we're putting together in what we call the Innovation Hub,
mm, mhm.
which we have launched
Yeah.
in partnership with the MSU Research Foundation about a year ago.
I want to come back to that in a minute, but give me an example of an innovation that has come out of the hospital environment that you all got involved in commercializing.
There are a number of those, but I, the example that I like to use is the following. We run something called a fellowship program for entrepreneurs, and through this program we teach them how do you identify a wicked problem in healthcare, and then how do you go about you know, designing a solution for that. And then we break them up in teams,
Yeah,
and then we sort of do a Shark Tank at the end and
yeah,
see who the
yeah.
winner is. So one of the groups identified a problem, which is the following: we often end up that we have a operating room that's ready to go. Doctors are ready, nurses are ready, the room is all set, but the patient isn't there yet.
Mm.
And these rooms are very expensive.
Yeah,
So you're going through thousands of dollars every minute.
yeah.
This is empty. The patient is on the floor and the patient is ready to go. The nurses have prepared the patient. She's ready to go. Everything is good. You can't get the patient from here to here. You know why? Because nobody can find the transport.
Mm,
So their idea was, how do you create an internal GPS
mm.
which allows you to monitor on a simple iPhone where
Like
movable
the
equipment,
gurneys.
yeah, where movable equipment is
Yeah.
throughout the system.
Mm,
So they won that. We invested a little bit of money to help them design a prototype,
mm,
and we piloted this on one of the floors.
mm,
It worked. The um, the good news is that it worked. The bad news is that the inventor was one of our radiologists who
mm,
quit being our
mm,
radiologist and launched this company.
mhm.
And they got funding for a seed stage and Series A from Arboretum Ventures in Ann Arbor. And, so it was a, it
Yeah.
was a success.
Yeah.
So that's one example
Yeah.
of something that came out of a need, that a solution was created, and then it was commercialized.
Yeah. So on those kinds of internal innovations that get commercialized, aside from the operational benefit to the hospital, what's the ROI on those kinds of activities?
Oh, we take equity in the company,
Mm.
and sometimes we'll also take a long-term royalty,
Mm.
depending on how much intellectual property and Henry Ford resources were
Okay.
invested in that. As a not-for-profit, we are very concerned about using our resources for for-profit ventures.
Mhm.
So we need to make sure that every time we do a partnership like this, we are getting something out of it.
Yeah. So Henry Ford has an investment portfolio based on these kinds of companies that they've invested in over time.
We have just launched a venture fund.
Okay.
Yes. That never existed here before.
Mm.
Our investment into these companies was our intellectual property, not
Okay.
our dollars and cents.
And then these outside, let's say I ran into a a young man a few weeks ago who I can't even remember what his healthcare, invention was, but he has some kind of healthcare system device that he's very interested in taking to market.
Mhm.
And how would you get involved if you got involved with somebody like that? How would Henry Ford get involved with some outside entity like that that has a small company or an inventor
Yeah.
that has something that they want to commercialize?
Well, David, we look at probably 150 of those or so every year.
Yeah,
And it's like mining for gold,
yeah,
right?
yeah.
So we're looking
Uh,
at all these companies and we're
a lot
sifting
of
them
fallout.
out, and a lot fall out. But
Yeah,
the five or six that stay,
yeah,
we really figure out a way to partner with them. But I so come and talk to us first and foremost.
yeah,
We'd love to hear about what
yeah,
the idea is.
yeah.
The first thing that we look at when we talk to a company is, what problem are you trying to
Yeah,
solve?
sure.
And oftentimes they cannot articulate
Hmm.
that. They have fallen in love with their
Oh,
solution,
definitely. Or their
and
technology.
yes, or their technology, and they can't articulate why I should also love that technology.
Hmm.
So that's sort of the first thing. When you come talk to me, tell me which of my multitude of problems
Yeah,
is your technology actually solving?
yeah.
And then we'll take it from there.
But let's assume that one of these businesses clears the bar, clears the hurdle, and it is a viable thing. How would you, what value do you bring to that inventor or that company, and how do you move that forward?
So the first thing that inventor will need is real world feedback. If it's a clinical product, like a better way of monitoring diabetes, or a better device for orthopedic surgery,
Hmm.
the first thing we do is we find our clinical champions. So we go to Dr. X in the system and say, here's a technology. We've done some due diligence. It doesn't look like there's much on the market like this. We
Hmm.
think it's kind of interesting. What do you think? And I'll get one of three responses. The first response will be, it's cute, but doesn't solve a problem that I have.
Hmm.
Okay. Number two, they'll say, well, it's nice. It solves a problem. It addresses a problem that I have. But you know what, Lisa? I was uh, at a conference in Los Angeles last
Yeah.
week, and I saw a company that did it better. So let's talk to that other company.
Hmm.
The third one, which is the one I'm looking for, is that they will say, this solves a problem that I have, and I'm willing to spend some time talking to the company.
Hmm.
So we make that connection with the actual user
Yeah.
of this device or technology that the entrepreneur is trying to
Hmm.
create. And many times that is exactly the connection that is needed
Yeah.
to help them modify, adopt, adapt
Yeah.
whatever they've created for
Yeah.
real world use. And
Yeah.
then after that, we'll do the pilot, we'll help them create a payer model.
Mm.
Oftentimes, they don't know who's going to pay for it.
Mm.
Is it the patient? Do we bill the patient? Well, no.
Yeah.
Is it, do you want the hospital to pay? We've got thin margins. Probably not. Do you want the insurance payer to pay? Okay. Do you have that from the payer? No. Let us introduce you to HAP. So we help them, during the whole life cycle.
Yeah. Well, that's interesting because, and I experienced this in my early days as an entrepreneur. Having that customer connection is extremely valuable because a lot of people, a lot of entrepreneurs develop something in isolation based on what they think somebody might want, and they don't have that, customer feedback, that customer discovery. And if you can provide that for them in terms of the clinicians and other people in the environment to give them the real feedback,
Yeah.
that can be valuable in and of itself.
Yeah. We also will be their Sherpa to the system, but if the system is not the right partner for them, we'll introduce them to others in the ecosystem. So, for example, if you've created a consumer device, well, we can't really help too much with that,
Mhm.
but we can introduce you to others in Detroit who are working with consumer devices.
Mhm.
So we have, not only can you tap into us at Henry Ford, but
Yeah,
through us into the ecosystem.
yeah. Well, it certainly seems like this activity has grown since I first met you and saw what was happening over here. And this innovation hub is the latest thing that I've heard about. You
It
just mentioned that.
is. It
Tell me
is.
about that. What's involved with that?
If you look at the most successful innovation programs in the country for healthcare, they bring together the following three things. They bring together clinical know how, entrepreneurial expertise, and venture funding. So before our collaboration with Michigan State University, we had the clinical know how.
Yeah.
Michigan State had the entrepreneurial expertise through Spartan Innovations,
Mhm.
and they
Mhm.
had the venture fund
Mhm.
through Red Cedar Ventures.
Yeah.
Now we have brought all three together.
Mhm.
So we can take an idea, we can create a business plan around it, we can fund the pilot, we can do the pilot, we can become a first customer.
Mm.
We can go from soup to nuts
Mhm.
on any of these
Mm.
these uh, technologies or
Mhm.
developments. And that is a very unique platform.
Yeah. So
So
this is a new entity, this hub, recently,
it's not
relatively new.
it's relatively new. It's not a new entity. It's just Henry Ford Innovations and the MSU Research Foundation combining our programs.
Mhm. And there is an incubator that is part of this?
Yes, and it's not an incubator in space because we actually made a conscious decision that we don't need more incubation space in Detroit.
Mm.
We have plenty of space.
Mhm.
We have this space, we have New Lab, we have WeWork, we have people
Town.
Tech Town, we
Yeah.
have people developing new spaces everywhere.
Yeah.
So our incubator is not about space. Our incubator is about clinical expertise, entrepreneurial expertise, and
Mm.
venture financing.
Mhm. So, so how is this going so far?
It's going
Is it
great.
meeting your expectations?
It's going great. We have, the teams have come together. We have had about 100 or so applications.
Mm.
We run something in partnership with MSU called the Conquer Accelerator. We're in our third year of the Conquer Accelerator, where we identify 5 companies. Most of them are from Michigan. We identify 5 companies. We run them through an incubator program. Um, Red Cedar Ventures invests a little bit of money in them.
Mhm.
They come here and they meet with our clinicians and others every week, and then at the end, the goal is to do a pilot of their technology here at Henry Ford. And then if the pilot goes successfully, then we take them out for more venture financing.
Mm. Mhm.
So it's going really well.
Yeah. So, how will you determine whether this whole thing, what's your metric? How do you determine whether this effort is a success? A lot. Sounds like you're investing a lot of time and energy and money, but how do you know that it's achieving what you want it to achieve?
This is the 64, $65,000 question. Look, we use the same metrics as everybody else. We look at the number of spin-offs we've created. We look at the amount of co-development that we've done. We look at how we've leveraged external capital. We look at whether we've created new jobs. We look at how many new companies are in Michigan versus any place else because we're attracting them from other states, other countries. So we have all of those metrics. We look at what the returns are on the venture fund, and
Mhm.
all that's there. At the end of the day, we also look at things that are very difficult to measure. Have we had an impact on patient care?
I was
How
going
do
to
you
ask you about
measure
that.
that?
Yeah.
You can't really, but we try. We have stories, and you know, have we actually created a place where our highest performing clinicians want to stay?
Mm.
So, how do you measure that? Well, we have stories. So, there's some quantitative measures
Mhm.
which we keep track of. And then there's all this qualitative stuff that becomes very difficult and can only be told in examples and stories.
Mhm. Yeah. Um, well, it is hard to get your arms around sometimes when you have these ecosystems and you've got all this activity going on. But certainly, it seems like there are some hard and fast measures that one can put in place, like how many people do you have in this? Like you say, you had 100 applications for this thing,
Mhm.
and will that be 200 next year, or how many come out of that? And how many businesses get formed, profitable businesses, that kind of thing. But it takes time to establish all of that.
It takes time.
Yeah.
Yeah. It's the work that we do here takes years and decades. And w- we are fortunate in that we're a mission based program for
Mhm.
Henry Ford,
Mhm.
because there are lots of innovation programs where the expectation is that you'll commercialize technologies and you'll be self supporting in 3 years. And that's
Mhm.
just the wrong expectation.
Yeah.
So,
What do you find that a lot of these uh, would be entrepreneurs, what what do they not know? What's the biggest kind of pitfall that you see with the people coming to you with their innovations, their inventions?
the biggest thing that they need to understand is they can have the best invention and the best technology, and we may still not implement it
Mm.
because it doesn't fit within our workflows and it doesn't solve a problem that we have and it doesn't have the right regulatory check marks next to it. There's no pair model. There's lots of administrative things
Mhm.
that we have to worry about, even if it's the greatest technology.
Mhm.
So what I would say to them is understand your company from the perspective of your buyer
Mhm.
and make it easy for me to buy your product and I'll work with you.
Yeah.
But the worst thing that can happen is somebody comes in and says, "This is a great technology. Yeah, you'll have to change the way that you operate on a patient,
Yeah.
but it's okay. It's not, you don't have to change
Yeah.
too much."
Yeah. Yeah. Yeah.
Yeah.
So we say,
So, no, we're not going to change the workflows unless
yeah.
the next cure for cancer will change
Yeah.
workflows. But for most things that we see, you have to fit within our workflows.
Yeah. Yeah. Well, we like to say there's problem solution fit, which that may not even fall in that category, right? If it's not falling into how the operations are, if it's not compatible with that. But there's also product market fit, right? It's got to be something that is deployable and that, where a business model can be built around it. And so, yeah, I can
Mm.
see where.
This was one of the biggest things about we do a fair amount of work with international companies,
Hmm.
and and they are amazing because at least 5 years ago they weren't as sophisticated as they are now. Everyone's becoming more sophisticated in this market, but
Yeah.
5 years ago we would have literally companies that would show up at a meeting with a
The gadget.
gadget, say this worked in country X where I'm from.
Hmm.
can you just try it in your OR and let us know, and we'd be happy to sell it to you.
Wow.
So that kind of naivete
Yeah.
has kind of gone down a little bit, but aspects of that, right? Not really understanding all the things that I need to go through in
Mhm.
order to actually get that technology into the hands of a surgeon in the operating room.
Yeah. Well, again, I was one of those naive engineer wannabe entrepreneurs, and I think that the thing that you benefit from, if you're in that situation and you have the communication and you get the feedback, you learn,
Yeah,
right? And then you say, okay, I got to be more prepared. I got to clear this hurdle, right?
yeah,
And so, again, I think it's helpful to have an entity on the other side that is giving you that feedback and saying, no, this doesn't really, that's not how it works here, right? And then you learn,
yeah.
right?
And you learned. And yeah, we're not a partner for everyone, and
Yeah.
not everyone is a partner for us, but that's true in entrepreneurship. That's
Yeah.
true in business.
Yeah.
So,
So, just to kind of recap, you started in consulting, and then you went into the university slash, I don't want to call it a corporate environment. You went a university environment, but doing this kind of community development work.
mhm.
Then you went out on your own to do, this kind of entrepreneurship development work as a business.
Mhm.
And then you came into the healthcare environment,
I
a
did.
corporate
I
environment.
did. Yeah.
Uh, so, without getting you in trouble about your current environment, what was your favorite time out of those times in your career? Where'd you have the most fun?
Right now, I'm having the most fun.
That's the right answer.
It's the right answer, and it's also the true answer
Yeah.
because it's the culmination of everything that I've done for 30 years.
Mm.
So it's bringing together my love of solving problems, which came through consulting, because God knows we have enough problems here
Yeah.
that require problem solvers.
Yeah.
It's my love of these large, complex organizations that have so much ability to impact everything around them.
Mhm.
So it's that. And, honestly, I got to tell you, it's nice not to have to worry about making payroll at the end of the
Yeah.
month, which is what entrepreneurs have to do.
Yeah.
So but my current job allows me to have real impact on real people in a way that nothing else in my
Mm.
career has. And that's really amazing.
Mhm. So what is the main thing, and I hate to boil things down to one thing, but, that in terms of the experience that you've gained from all of these different, activities, how has that helped you to be an advisor or a guiding force for these entrepreneurs who you're working with nowadays?
Well, it's given me a lot of empathy for entrepreneurs because I know that the problem they're trying to solve is wicked. I know that the road that they're trying to go down is really rocky. And I also know that for a lot of them, they need to get there fast because they have left maybe a well paying job and taken a flyer on this new company.
Mhm.
So, for their own lives and the lives of their families, they're trying to do things in a expedited way.
Mm.
So that gives me a lot of empathy for them because then I have to explain to them, well, yes, that's your timeline, but that's not the timeline of a university or a hospital. We need to do things in a different way. And it just allows me to communicate with them in a way that hopefully I don't, that's helpful.
Mm. Mhm.
Right? So I
Yeah.
think it's the empathy that has
Yeah.
come from really having worked in all those different environments.
Yeah. So I guess last question, and then I'll throw it back to you in terms of anything else you want to indicate. But you're in the midst of a lot of this development, this huge investment that's taking place over here. You're at this, you're leading this innovation institute at Henry Ford. So if you put yourself 5 years down the road, what does this whole thing look like? What do you want it to look like?
I want it to look like this, but at a greater scale. We need we need to scale. The health system is growing. We almost doubled in size last year when we
Mm.
did the joint venture. Um, So we need to scale our program for those new hospitals. We will need to scale again when our new hospital comes online. We're doing great work here, and I think we need to keep doing it and keep scaling to keep up with the system itself.
Yeah. Well, again, I appreciate your all the stuff that you've done here, and again, I've known you for a number of years, and I appreciate just seeing how things have developed here. Um, is there anything that I missed in this discussion that you might want to highlight at this point?
Is there anything you've missed? I think everything sounds exciting in retrospect. You know, my career in consulting, I did Penn, which was an amazing institution. I was an entrepreneur. I'm a vice president here. It all sounds exciting in retrospect, but it's also all, you know, all of those jobs have had ups and downs,
Mm,
right? And I only talk about the ups because, you know, that's what we're here to do.
yeah.
But I think it's important for entrepreneurs to remember that even if you're not an entrepreneur, if you're an administrator, if you're a executive in a finance company, there's a lot of downs associated with that too.
Hmm.
So if you have a great idea and you want to change the world and you think that you can do it, just do it
Hmm.
because the status quo is also not perfect.
Hmm. Give it a shot.
Give it a shot.
Yeah.
Give it a shot. It's tough, but
Yeah.
you know what? Just give it a shot.
Yeah. Well, again, I appreciate it, and I hope to get a little bit of a tour.
Yeah, we'd love to give you a tour.
All right,
Yeah.
may get some B-roll out of that.
Okay.
All right, well, thank you so much.
Thank you.